I'd like to introduce my colleague, Holly Burkhalter. Holly has been a mentor for me in my career and a mentor for many other folks in the anti-trafficking and violence against women and children space. So Holly has an excellent panel for us here. I will just say that she is someone who sees the depth of issues and the breadth of issues and brings folks together to combat them. So welcome, Holly.
Oh, I'm so happy I got music. I was feeling a little bitter about the fact that we were up here and I didn't have a curtain. You know, I mean, really. Thank you all for being here. There's a lot of great things going on at this conference, and you chose me. No, I mean, you chose us. You chose us to come and share an hour. We have a wonderful panel, and that really, I think, shows the kind of depth and breadth of the anti-trafficking movement. We have domestic anti-trafficking leaders with Fair Girls. I'm very happy to have Lola and Jennifer here from Fair Girls, which is a service provider for trafficking victims in this country, in the United States. We have researchers, one from the Veterans Administration, who are a trauma researcher and a university and NGO researcher. We have clinical psychologists. We have a colleague from the FBI who's a specialist on trauma-informed care and victim services. So that's a lot of great information. We also have 1 hour. So my rules of the road are that it's quite brutal and terrible, but I would really like to involve you. So our panelists are going to speak for about 5 minutes, and it doesn't begin to do justice to all they know or all that you would be interested in, I'm sure, but we'll bring out more of that during our questions. I saw that done really, really well this morning on a panel on survivor power. It was perfect. There was lots of time for questions. But there were 2 panelists. We have 5, so this is going to be kind of a race with the clock. But I think we're going to get there. What I asked the panel to do, because there's such a lot that can be said about survivor restoration and reintegration, that it would help us if we kind of stayed on the same page by looking at what are some of the most essential elements, most essential services, the most essential insights, the most essential learnings from care and restoration and reintegration, so that we can see what's on the table and then start looking at it. So people are going to riff on various aspects of that challenge, which is, can you boil down services and collaboration with people who have a lot of needs and had a lot of needs before they were victimized, and have a lot of needs, more needs afterwards. So how do each of these people in these wonderful specialties and fields, all part of our anti-trafficking community, how do they look at that question? We will start with Michelle Lee of the Veterans Administration. Michelle's a very good friend and a longtime colleague. The VA stole her from us. She's a clinical psychologist, and she is a specialist on trauma-informed care, and developed many of IJM's tools and resources in the course of her career. So we'll start with you, Michelle, and take it from there. Thank you.
Hello? Great. It's wonderful to be here, and I have the privilege to actually talk about one of the cornerstone tools that was developed by International Justice Mission. It's a validated and reliable tool called the Assessment of Survivor Outcomes tool. And this tool actually is a really critical tool that allows us to assess and understand the needs of the individual with lived experience, the survivor, while also understanding what is the impact of the programming that we have in our context for International Justice Mission. And so what we did back in 2015 was we had this pretty scrappy tool that we ended up going through a really rigorous internal validation and external validation process. And so our Merle team helped us design a study that could really help us see, what is this tool trying to assess, and does this tool in fact assess what we say it is assessing? And so we were really pleased to determine through the internal and external validation that the tool was in fact really understanding what the survivor was going through, what the survivor was experiencing, and then also helping us to design programming that would really address the needs of that individual. So if you take a look here, this is just a quick snapshot of the tool itself. There are 6 domains. So those are really sort of the main components that we look at when we're really trying to understand a survivor and their needs. So we're looking at safety, legal protection, mental well-being, economic empowerment and education, social support, and physical well-being. And then underneath each of those 6 domains, we're able to see, like, what are the actual specific things that really would help us to understand that individual's levels of safety? What would help us to understand their level of vulnerability with safety? And likewise for legal protection and so forth and so on. And so we designed this tool with a Likert scale, and that Likert scale then allows us to assess where the individual really is at the time of intake, maybe midway through their programming, and then at the end when they are completing their programming. And what we're really trying to see is, are they restored? And restoration as defined by IJM is, are they functioning at a lower level of vulnerability? We're realistic to understand that there will always be some amount of vulnerability, but is there a decreased risk of vulnerability that allows them to function safely within society? And then when we do assess that that individual is at that place, we're able to have them exit programming, and then a year later, we end up assessing them again to see how are they functioning in society. And so this tool has really been a cornerstone tool, like I said, for IJM. And what's really exciting is that we've had organizations who have really been able to implement that tool now across the globe.
Thanks so much, Michelle. We will draw you out more on that when we have time to have questions. I'm going to turn to Lisa Slavosky, who is the Child Protection Advisor for the FBI. She spent many, many years in the global human rights movement with my organization, International Justice Mission, and I'd particularly appreciate you to sort of talk about what you see as the primary needs of the victims that the organization is serving, and particularly the issue of trauma-informed care for victims who do experience trauma from having been trafficked. Thanks, Lisa.
Thanks so much. Just a little bit more of a self-introduction. As Holly said, I'm Lisa Slavosky, and my role within the FBI is within our Victim Services Division, but I'm also embedded with our Crimes Against Children and Human Trafficking Unit, which supports all of our work really with any human trafficking violation, whether with children or with adults. And so, I'm probably the surprising member of this panel. Why is someone from the FBI speaking on survivor reintegration and trauma recovery? But in many ways wanted to draw out sort of the essential component of law enforcement-based victim assistance. I'm speaking from a U.S. federal based perspective, but realizing that you all are representing many different country contexts and other contexts. But one of the things that we know within the anti-trafficking movement is that so many victims of human trafficking, their first encounter with assistance or with any form of identification is by law enforcement. And for many victims of this crime, that is even before they even have the understanding or recognition of their own, that their experience is a victimization of a crime, or that they, it may not yet be something that they have an understanding of that. And so the way that law enforcement engages with victims of human trafficking is such a critical component, one, to ensure that there actually is access to service provision, so bringing in this broader protection that leads to longer term recovery, as well as victim access and engagement with the criminal justice system in general. It's interesting, I think, from a federal law enforcement approach, we are very much guided by the specific mandates that we are bound to. So what dictates our service provision is really under the Victim Rights and Restitutions Act, the Crime Victims Protection Act, and the Attorney General guidelines on victim witness assistance. And the way that FBI victim assistance works is we have victim specialists that are embedded across each of our field offices around the country. So 170 victim specialists around the U.S. who are directly embedded within the investigative teams that they're working alongside. And as a result, able to bring that multidisciplinary approach to the engagement with a victim of a crime. One of the things that I love, and we just, the U.S. just put out, or the Department of Justice just put out earlier this year, an updated version of the guidelines on victim and witness assistance. And one of the things that it really highlights is for especially vulnerable populations, and victims of human trafficking are considered within that, acknowledging that there are these systemic barriers that really inhibit that broader engagement with the criminal justice process, and as a result highlights that need for victim-centered and trauma-informed approaches to the work of how are we going about that engagement. And that really is the role then of our victims services component, is in that multidisciplinary work, ensuring that there are individuals that are part of that team who have trauma expertise, who are coming alongside the investigative personnel in order to ensure that there is a trauma-informed response. So our victim specialists are providing on-scene assistance, they're providing crisis intervention, they're providing referrals to especially medical and counseling resources, as well as other emergency services. And then really trying to build that connection for victims into then the broader services that are needed for the longer term recovery piece. So I'll pass that on. I'm sure that there's so much more I could say, but we'll pass along.
Thanks, yes. I'm hearing things that sound to me like IJM, and I never really thought of IJM having that much in common with the FBI. But I really like the emphasis on having people that are experienced with trauma-informed care right at the beginning of the process, which very much reminds me of the way IJM assists police on the field globally. We're going to switch gears just a little bit and turn to Eric Kasper down the way a little bit, who is a researcher, George Washington University, and a human rights NGO, and ask him to talk a little bit about some of his research, particularly what you've learned recently about survivor perspectives on restoration and care. Thanks, Eric.
Hi, everyone. I'm Eric Kasper, and I'm a senior consultant with Humanity Research Consultancy. We've partnered with IJM and Winrock on a number of things over the last few years. I'm just going to speak a bit about a piece of research we did on survivor perspectives on the reintegration process. Basically, we talked to 16 survivors of trafficking in Cambodia and 24 in Bangladesh. And we asked them questions around what constitutes successful reintegration and what they think contributes to that process as well. And basically, from our interviews, we distilled the definition of reintegration as finding one's place again in the human webs of relationships that make up society. So really broad kind of human definition of what successful reintegration means. And we've distilled 4 kind of key elements to that. 1, connection to family. 2, respect and acceptance in the wider society. 3, mental health. And 4, kind of financial or economic health and stability. And for us, we really, all of that seems kind of self-explanatory and obvious and intuitive, especially if you've been in the business for a while. And a lot of programming is indeed meant to address each of those things. But what we tried to do in our research and the report was to articulate this as not 4 separate issues or one kind of thing of reintegration, but kind of reflecting the complexity of trafficking and reintegration as a whole phenomenon. So each of these 4 issues is intimately related to each other. So for example, we've seen a survivor come back and they migrated in the first place in order to find work. And so the thing they need now is a job or some skills. So somebody offers them a place on a livelihoods training program, but they can't attend the livelihood training program because they're depressed and suffering from trauma and can't get out of bed, right? So if you're not aware or attuned to this kind of thing, then it looks like, oh, we offered them a place on the program and they just didn't turn up. We don't know why. People just don't turn up. So alternatively, we've seen cases where anticipating that a survivor coming back from abroad will have trauma, you first offer the survivor a place on a mental health support course, or offer them a set of counseling sessions. But this survivor desperately needs money to survive, so they can't afford to take time off to go get counseling first before they can start looking for work. So again, from the perspective of the service provider, you might think, well, first they didn't want to go because of the job, and now we offer them the mental health support, and they don't come for that either. So what's wrong? And in fact, all of these issues are interrelated, right? And each individual survivor will be experiencing a slightly different set of circumstances. So our suggestion is that interventions and support need to be attuned to that level of complexity that's going on. All of the issues are related to each other. And so there should be a system of identifying what the specific survivor needs. If it's mental health support first, okay. If it's livelihoods training first, then that's okay. Basically, it requires experimentation and trust, and it comes down to a highly relational aspect. And yeah, so in some cases, interestingly, successful reintegration might look like migrating again, might not look like reintegrating permanently in your home place. And one of the most surreal, interesting meetings we had disseminating the results from this was with a high-level official in Cambodia, where we sort of explained, like, we noticed in some of the areas where we did research, we did some interviews, that people are telling us there's just no economic activity in this area, and that's why everyone has to leave, and they take great risks to leave, even though they're well aware of the risks. And after explaining our findings and all of this, the official said, yes, we definitely agree with you, but why can't they just stay? And again, we explained, and we realized that sometimes there are strong incentives not to see it this way, and that he was under a lot of pressure from the government not to be seen as supporting migration for whatever political reason. So yeah, I just I guess to sum up, the research is suggesting that support for survivors should reflect the complexity of the overall systems that generate trafficking in the first place, and they should be highly relational and attuned to the specific needs of the survivors.
Thank you. Service provider, and A21 is well known to many of you here, and a good friend and collaborator with IJM and with others. Tell us what you see from your work as the kind of essential services. Anything you want to add or comment on the other presentations thus far would be most welcome. Thank you.
Thank you. Hi, everyone. So my name is Rhiannon DuBois. I'm a clinical psychologist from Australia, that's the accent, based now in Texas, where our global support office is for A21. So I've been with A21 for 6 years, and I was just saying to Michelle, I got connected with IJM and Michelle sort of 3 or 4 months into working with A21, and I came in with this background in clinical psychology, and I thought, okay, we need some outcomes, we need to be able to measure, is what we're doing actually effective? And as a clinical psychologist, I thought, okay, so we need to measure post-traumatic stress disorder and depression and anxiety, and my team around the globe were quick to tell me actually there's a lot more that we need to measure. And then we got connected with Michelle and learned about the Assessment of Survivor Outcomes tool, and we've now been using that for 5 years. We've got 5 years of data, and we're big proponents of the ASO at A21. So I would encourage any aftercare service providers to look into the ASO. It's been fantastic and has been so good in informing our case management and actually our aftercare program to look at what are the key areas that we need to focus on, what are those essential services. So A21, we're located in 14 countries. We do aftercare work in 6 countries. So we're in Greece, Bulgaria, South Africa, Cambodia, Thailand, and in the US, we're in Texas and in North Carolina. So really our services, our program is very similar across those different countries, but we've found we really need to take into account culture, where we're working, and the individual needs of a survivor. So if you look here, we can see it like the essential A21 aftercare services are outlaid here, and there's nothing surprising there. We work from initial crisis intervention, we work very closely with law enforcement, we have hotlines in different countries, so we work with survivors soon after their exit from trafficking, and at that stage there's a lot of crisis intervention, providing emergency accommodation, care packs, maybe assisting with repatriations, relocations, helping a survivor to stabilize. Those who choose to stay in our program long term, that is where we really see the results. The results according to the ASO for those survivors who are engaging in the services and receive the mental health support and assistance with finding stable and safe employment and doing vocational training and education. So some survivors will stay in our program for up to 5 years or so. So these are some essential services, but if I had to boil it down to probably the most essential service, which is really hard to do, I would say accommodation stands out as number 1. And this, if you're working in aftercare, can be the most challenging part of providing aftercare services because A, it costs a lot of money, and most of our organisations, we're working for NGOs, we're donor funded, but Maslow was onto something. Those that housing is definitely really important. Again, as a psychologist, I was like, we need like great mental health experts to be working with these survivors, which we do need trauma-informed mental health clinicians to be working with survivors. But housing, especially for survivors who are coming out of trafficking, is really probably the most essential service. So we're in 7 locations. The housing looks different in each location, and that would be a big thing for me to say, like, what works for us in Greece doesn't necessarily work in South Africa or Cambodia. So I think being flexible is really important. So in Greece, we've been there for 15 years. We did start off, they started a big shelter because they thought, okay, we're working with survivors of trafficking. What do? We start a shelter. That's what all anti-trafficking organisations working in aftercare do. So they started a big shelter. We've had in Greece survivors from 65 to 70 different countries. And so after doing that for about 10 years, they realised this big shelter long-term model is not working for the survivors we serve. Now, long-term shelters can work, but you've got to be flexible. So we've now brought that down to a 3-month stabilisation shelter. So we've got a shelter in Greece. We also have apartments where survivors can move into an independent apartment and live there for up to 12 months, rent-free, utilities are paid for, and that then helps them to focus on finding employment or doing vocational training, doing education. Maybe if they're in Greece and have been trafficked into the country, learning the language so that they can then get a job. We also do rent assistance For survivors who are living on their own, we'll provide a lot of financial assistance. And we actually also launched foster care in Cambodia just recently last year in partnership with another organisation, Hagar, who have been doing foster care in Cambodia for 27 years, because we realised a lot of the minor survivors were trafficked by their parents. We'd work closely with the government to do a family-based assessment to see, is it safe for them to return home? If it wasn't, rather than placing them in long-term institutionalised care, we'd prefer to place them in foster care. So we've just launched that program, and that's going really well. Again, I would suggest we need to be flexible, teachable, always open to, is our program working and what can we change? And my time is up.
Thank you so much, Rhiannon. That was really inspiring, as this whole panel has been. It was interesting when you said what you learned was if you could only pick one, or at least the first essential was housing. Jennifer from Fair Girls said almost exactly the same thing. So I'm very glad to have Lola Maraiyesa end up our panel here about what Fair Girls is doing, and I know shelter is part of your program here in the DC area. Is that correct?
Yes, yes.
Please.
So once again, thank you all for joining us this afternoon. My name is Lola Maraiyesa, and I'm Senior Case Management Coordinator with Fair Girls. We provide intervention and holistic care for survivors of human trafficking and also commercial sexual exploitation of children, also known as CSEC. So our age ranges from 11 years old to 26. So those are, to give you a framework of who we serve and who we are able to serve. And one of the primary services that we provide for all clients, regardless of status or age, or even trafficking experience, it can also be DV. We don't really turn anyone away because, a helping hand is a helping hand, and we have more than enough resources to lend as many hands as possible. But one of our primary services that we provide is case management, and the core of our case management services lies in our individualized service plans. This ISP serves as a blueprint for what we case managers and clients get to sit down, collaborate, and really it's this blank slate that we provide to clients, our survivors, and they get to put pen to paper. This is the space where they get to put their voice out there to us and say, this is what I want, this is what I need, and we let them know you are allowed to demand what you want, what you need, because you're able to. And again, we're here to be of assistance. We're here to provide those resources for you, and our ISPs help us as case managers and, again, clients to have that structure that they need, but to also see that the things that they want are not out of reach. Like going back to school, you can definitely do that. Getting a job, you can definitely do that. One question I'll have for how many of you right now have your IDs on you? Raise your hands. Thank you. And how many, keep your hands up if you know where your birth certificate is? Keep your hands up if you don't know where your birth certificate is, but you know that just one call to mom, grandma, auntie, uncle, just one phone call, and you will know where your birth certificate is. No, yeah, raise your hand. Okay, so but for a lot of these clients, they don't have that. They don't have an ID, no birth certificate, nothing. And, this is where we find our successes, is in the little things. For example, as case managers, we get to help clients, navigate the bureaucracy of going to this place first to get your ID, then this place first to have your address verified, and then to social services or social security services to get your birth certificate. And I remember the first successful run of that. Her initials were SP. She sat in front of me when we finally got through the hurdle of that week. She had her birth certificate in her hand, and sorry if I get teary, but she was like, "Oh my God, Lola, I exist." And, it's moments like that. It's being able to provide something as, somebody's birth certificate, and which signals for her that not only does she exist, she kind of said it lightheartedly, but, for her, that means next she can get an ID, she can receive benefits, she can go to school, she can apply for jobs, she can be her on her own terms, and that is monumental. I mean, so much more than we even realize how important it is to have sort of that physical manifestation of this is who I am, because it matters, Everyone asks for it, you need it to apply for this, this, and that. So being able to provide things like that is very instrumental, and we're very, very happy to do it. Other goals also range from just getting mental health services. Even though we are here based in DC, we do get a lot of clients from outside of the US, and also for them, achieving status and being linked up with the right legal services, and also like panelists here mentioned, or co-panelists here mentioned, being able to navigate the criminal justice system in a new country, and also sitting in front of FBI and ICE and Border Patrol, and who are all these people, why are they asking all these questions? But being able to be there for him and provide him that support is also very instrumental. And another part of our program that leads to shelter is our Vita Home, which is our transitional residential programming, where residents are 18 to 26-year-olds are able to stay for up to 180 months. And the same thing sort of goes. We work with them to develop their objectives and their goals on their ISPs. And, it's very important, as Rhiannon mentioned, like housing and just having a roof over your head is very important. Although it's very temporary, it's still a relief to know that while you're trying to get your life together and while you're trying to put all these pieces into place so you can create the picture that you want to, you have a roof over your head, you have somewhere to come home at night, and also you have people there to support you, 24-hour service. There's always staff there, and at any point, their social, economic, and well-being, all those needs are able to be met by our residential care coordinators, the case managers, senior housing managers, like all hands on deck approach, because for some people or some survivors, that matters. When I first started at Fairgroves, I was the residential contractor, nights and weekends. There was a young girl. She used to have night terrors and would always run downstairs. But after a while, she'd just be like, I don't come down anymore because, just knowing that somebody's downstairs has helped her with her night terrors. Just knowing that when she wakes up in the middle of the night, it's not in some strange surroundings. And, and just knowing that there's somebody down there who will be there to listen to her is also monumental, and again, works in reintegration, because these are the types of spaces that they need to be in to be able to have that clear mind, clear everything, clear slate, to be able to then see, okay, how do I put myself back in society, and what role do I play, and where do I fit? And like one of my co-panelists mentioned, how do I go back there with my dignity and respect, and also just they want to be functioning members of society, and we're glad to be able to kind of provide the tools for them to lay the foundation to be able to do so. Thank you.
Well, thank you. On that note, let's hear it for our panel. Well, this is the best panel in the world, and you notice how much time we have for all of you, because you all followed the rules. I appreciate it so much indeed, and there's a very rich banquet out in front of us, and much more to explore. So, I don't know all your names. I know many of you, but I will designate folks. There'll be a microphone coming. Elizabeth's got a microphone. I think there's another one somewhere in the room. If you would just say who you are, if you're comfortable with that. So, and you can direct your question to the group or to any specific panelist if you'd like. And keep it short so we can get the maximum conversation going in terms of the panelist participation in the questions. So bring it on. Oh, Dorothy. Go right ahead. Good to see you.
Good to see you. Thank you so much for your commentary today. One question, my name is Dorothy Taft. I'm with the Market Project. One question I have for you is, what evidence have you seen with respect to a connection between having a job in a trauma-informed workplace and the healing journey? Is any evidence out there that you've tracked?
We haven't done the research, but I can tell you that that is so vital to have job placement in a workplace that is trauma-informed. We've seen that happen compared to survivors having employment in non-trauma-informed workplaces and ending up quitting their job because a boss or someone said something that was really insensitive and very triggering. So it's really important, and I'm excited to learn more about your work.
Just to add to that, IJM, at the time of the internal-external validation, we had about 10,000 pieces of data that we were able to analyze. And the reason why economic empowerment and education made it up there as one of the 6 critical domains was for that very reason, that actually employment or education, depending on the age of the individual, was actually critical to restoration. They needed to be able to have safe employment. They needed to be able to have safe access to education. And so the specific questions that we were able to target with the ASO, can't move forward on this, but if someone's able to click the slides, back one, it shows just the questions that really do target education and economic empowerment, right? So this idea of being able to have adequate income from non-exploitative work or productive assets, right? So the idea of safe employment and a safety net, so that when an individual is in potentially a situation of crisis where they need access to money, that they're not actually having to go to something that is unsafe. And so it's an excellent question, because that's exactly what we were able to determine through the research.
So A21 has been using the ASO now for 5 years. So just this last week, we've been looking at our data from the last 5 years. Sadly, economic empowerment and education is the lowest domain of functioning, which we need to increase, and that comes out consistently each year, and that may be reflective too of the countries we work in. So I think providing work and business opportunities for survivors is crucial. So we use the ASO to help inform, okay, what are our biggest needs for survivor care, and economic empowerment and education is the biggest.
Thanks for that comment, Rhiannon. When we aftercare providers, of whom IJM was one, you just like to think these are all good things. We'll just give that. But it really wasn't until we had this tool to measure what's actually helping, and where are there needs that are not being met. And I must say, it's particularly helpful to hear you, Rhiannon, from A21 say, hey, we fell down on that. We can see it. The data shows we can do better. We need to do better. Thanks for that, particularly. Ma'am, please.
Thank you very much. Joy Crawford, Jamaica. Anecdotally or by research, I was wondering if you could comment on integration of the survivor in their family, their household, and probably their geographic community, what that experience has been like, and if there's any tips that you can share around that. Thank you.
Yeah, I can speak to that. So when clients first come to us, one of the questions we have on our intake is actually, are there any members of your family that support you, and in which ways do they support you? And also, are you comfortable with us reaching out to them? Some of them, the answer is yes. Some of the answer is absolutely not, because yes, family can be traffickers, and it is just the last place they would absolutely want to go. But for those who are comfortable with continuing to work with their families, or even want to leave the house to go home on the weekends, which they're able to do, we work with them as well, parents, aunties, uncles, whoever the survivor has, pinpointed as, this is the person I can go to, and we ask them the same questions, in which ways do you need us to help support you so you can continue to support the survivor? Again, keep in mind our range, they're very young, again, from 11 years old to 26 years old. Those are babies. So the tips would always just keeping that line of communication, and also sort of without impeding, reminding relatives as well that, this journey will take some time, and that, the trauma that, the relative has experienced is, more than what, if it's out of their hands, it's also out of their hands. Because we also get, relatives who feel like they haven't done enough, they're not doing enough, they weren't present enough, and it's sort of out of your hands, in the sense that now they're in a space where they can go on that journey and make those decisions for themselves, and you don't have to worry. There's a lot of worry. Again, any mother or relative of an 11-year-old would be worried, but definitely open those line of communications, and also asking family, what do they need to be to have that support? What resources do they need at hand to be able to create an environment that is not re-traumatizing for our survivors, and then also traumatizing for themselves? Because it's a lot to deal with those stories, it's a lot to sit with, and it's just important to always communicate, what do you need? Because there are more than enough resources, so to speak, to help meet everyone's needs at the same time.
Eric, did your research turn up anything? I'd love to hear your thoughts on that.
I can add a little bit. I think it's quite different in different contexts. I think, in the US and in the UK, I think I've seen a lot of individuals in houselessness or in after trafficking who can't reconnect with family. But in the case where we were researching and in the other countries where I've also looked at this, so in particular Bangladesh and Cambodia here, it seems really rare that people don't connect with family. But in our research, it was very, very important, right? Like getting back into the family, having the family support. So we saw some cases where extended family was involved in the trafficking, right? Like an uncle or a sister's husband or something. And it didn't really prevent them from coming home to the family. But that nature of, it didn't mean the family was all fine, right? There are lots of instances of domestic violence or broken households or, but somehow just being in the household is not in question, I guess, in ways that I think it would be elsewhere. And, it comes back to what you were saying about housing. In Bangladesh, one of the major survivors groups, Anirban, that I've worked with over the last few years, it actually started because women after trafficking were in a shelter and they found themselves stuck in the shelter for year upon year because having registered themselves and gotten the status of a victim, then some organization had a legal mandate to take care of them, so they wouldn't let them go out and get in trouble somewhere else. So they're sitting in the shelter seeing that the traffickers are out there running around the community, but I'm stuck here, so that can't be the right way, right? So, yeah, and I think the community aspect, it also raises some interesting questions because people also obviously said that respect in the community is really important. Where was I going with this?
Let me jump
sorry,
in just
I've
for a
lost it.
second.
Yeah.
It's perfectly all right. It just makes me extremely happy when someone who's quite a bit younger than me has just a moment. Like, why not? We'll get back to you. I was just going to make a quick comment from IJM's perspective about family reintegration, and thank you for asking the question. The case type that I think poses particularly difficult challenges is online sexual exploitation. Maybe Michelle has a word or two about that because the kids can be extremely young and the abuser is very frequently, in the majority of cases, mom or aunt right in the home, and that means home is not safe. We have a few cases, I don't know the numbers, where there's some kinship care or something that can happen, which is much, much better than an institution. All of us would agree, and I don't think we put young children in institutions, but the enormity of the crime and the number of victims, 500,000 in the year 2022 alone, and many of them tiny, does pose challenges for family reintegration because those kids cannot go back to a situation where they're being stood up in front of a camera so that foreigners can direct abuse against them. Does anyone on the panel want to, Michelle, did you want to say something about that?
Yeah, just to add to what Holly is saying, because of the age of the victims for this type of crime, online sexual exploitation of children, they're typically quite young, and there's also sibling groups that are often victimized at the same time. And so what IJM has really tried to do, exactly like Holly said, is to see if there are alternatives in terms of care and shelter for these children. So sometimes there are situations where children are sent, and they do participate in a program through some sort of a shelter type of care. But really the long-term goal and what the ASO is really trying to get at is how do we help them to reintegrate back into society at a time and an age where the individual can be safe. Again, because of the nature of the crime, the victims are young. So sometimes that length of time is longer, and it's longer than what IJM has experienced in other types of crime. But we are really trying to, and IJM has really tried to develop a model of care that really addresses the holistic care of the child and really as reaching towards the reintegration of the child into the community.
Just another word on sort of the integration process, I think one of the things that we've seen at the Bureau is that a lot of the victims of trafficking that we work with are coming and speaking right now about minor victims of trafficking. Many of them are in their families of origin at the time of their trafficking experience. And so I think it really highlights that need for a multidisciplinary response. As mandated child abuse reporters, that is an area where if there is a minor who is a victim of trafficking, that does then mandate a report to Child Protective Services, and so immediately then engages Child Protective Services into that case approach already. And so I think what that then does is our victim specialists are working both with a minor victim, and if they then are with a parent or guardian, then they're also working with the parent or guardian or other family member, but also then there's that Child Protective Services response as well. And so multidisciplinary teams will come together to really be collaborating on what are the various needs of a victim from multiple different perspectives. And I think really highlights that just sort of comprehensive and coordinated approach that has really been researched to be, seen as most effective when you have more coordinated and integrated approaches as well. One of our key partners is the National Center for Missing and Exploited Children, and one of the benefits or the services that they also provide is they have staff members who will provide services directly to then the Child Protective Services workers who are then engaging with minor victims of trafficking as well as with their family members as well. So that, again, it's just trying to bring those coordinated supports around victims.
Thank you, team. Yes, ma'am. Right in the blue.
Hi, Danielle Fair with the American Bar Association Rule of Law Initiative. My question is on the ASO, the assessment tool. So you mentioned that it's used globally. Have you and in what ways have you had to adapt the tool based on country context?
Yeah, that's a great question. So initially when the tool was developed, it was actually like a grassroots initiative out of our office in India. And so the India office developed it, and our other offices globally had heard about that, and that's why we went through a validation process. Because what we wanted to really determine with the tool was, how do you have it high level enough that there are few adaptations needed, while also relevant and applicable to each context and all the nuances, even to the question that was brought up before, like there are culture and country context specific things that are going to be specific to that place. And so we now have the tool in a state where it is validated, and we do not actually prefer to make adaptations to the tool, because then that it would actually interrupt the integrity of the tool. And so what we did with the tool as part of the internal validation was we approached it through a three-prong approach. So we did survivor and lived experience individuals access to the tool and their experience of the tool and the questions. We had a case study, a global case study, depending on the case type that we were trying to combat. And then we also had the provider's experience with the tool. And so from that three-prong approach, we were able to develop a tool that really is able to be applied across contexts. If you look at the questions of the tool, they are quite high level, but they are really trying to get at these core components. And then of course, when the tool is actually being deployed, like individuals will put in, context-specific information or maybe context-specific nuances into the questions themselves, but we really do not actually modify the tool very much in order to maintain the integrity of the tool.
If you could just pass that across the aisle to, oh, that's fine. You had a question too. It's actually very similar. Oh, okay. I wonder if I could just exercise my unlimited power of having the microphone. I wondered if you don't mind being put on the spot, Mary, we have a law enforcement expert who's worked with IJM for many, many decades and is a former chief of police, and I wonder if you'd just comment on what Lisa was talking about, which is the role of police in first contact with victims. If you have any observations about essential behaviors or essential trauma-informed process from the very beginning of a trafficking apprehension situation. If you don't have any ideas about that at all, Mary, that's fine. I'm just.
Out of a victim that isn't well supported. And
Speak up, I'm not hearing you.
I don't think you're going to get a lot of information from a victim that isn't well supported and doesn't feel safe. It's kind of like someone spoke about Maslow, and it's those basic needs that have to be well supported before you can start moving into any kind of investigative stage. And but I think also is to understand that support and that trust and that feeling of safety needs to happen across their experience with criminal justice system. But that first interaction is also going to inform and impact the victim experience or the survivor experience throughout. So if that initial contact isn't supported and they don't feel safe, you're not likely to get the information you need and the cooperation that you need in order to go after the perpetrator and ultimately obtain a conviction.
Did you find, just one more quick follow-on question, thank you for that. Do you find that your police counterparts in, say, Cambodia or in India, you served in both areas and you've been at lots of the other field offices too, do they take to that approach or is there resistance to that? Because particularly, I think, for victims, well, both of sex trafficking and, say, bonded labor, those people are not going to necessarily be respected by police, particularly those that are in the sexual exploitation industry. And is it a stretch for police to play that role of dignifying the victim right from the giddy up?
I think, what I have found in working with law enforcement agencies across the world is that they don't know. Like, they haven't received good training and support, and actually, they want to do a good job. They want to obtain convictions, and they want to support victims, but they don't know how to do it because the training and the resources just haven't been there for them. And I think if they have it, if they understand it, I think they're willing to actually apply it.
Thank you. That's encouraging. Yes, ma'am.
Can I just add just one moment to also what Mary was saying, which I think one thing that's interesting is there's a lot more research related to how positive police responses actually lead to greater engagement with criminal justice processes, and that's fairly well documented. I think there's also interesting research out there on how positive engagement with police can actually be a first step towards a recovery process and improved mental health outcomes as well. And in particular, just because of the way, and one study in particular that I'm referencing comes out of Australia, but speaks to how that engagement with law enforcement, and this we know just from understanding trauma in general, that individuals who've experienced trauma, there's a sort of a perception of certainly victimization, of helplessness, of being violated. And so what can create that positive experience with a police response is if they feel validated in the sense that wrong has been done, to having a sense of being believed. Now, obviously, in the context of an investigation, has to, have some sense of neutrality within that, of like looking into it, but acknowledgement that wrong has happened, non-acceptance of the crime, non-blaming attitudes, relating to the victim as a person, empathetic listening, and taking action, and those then leading to some positive mental health outcomes as well. And so I think merging that with our knowledge of what is trauma, and then how do you engage a trauma-informed response, that sort of meshes with a lot of that broader research that we understand of trauma-informed care as well. But just wanted to kind of speak to that because I think, we know that the first priority of a law enforcement response is a disruption of harm. But so to know that engagement with the victim can both lead to both a disruption of harm, but also to positive both mental health well-being outcomes as well as criminal justice outcomes is really important.
Super helpful. Thank you, Lisa. Thank you, Michelle. Yes, ma'am.
Joy again. Yeah, I'm missing home, so I talk a lot. No, but just for anyone, I was wondering around the issue of gender. How does gender play in all of this? Are you seeing any kind of differences? So, for example, back home, when it comes to our boys, it's really mainly them being in gangs and how they're taken from their homes to join in that kind of activity, while the girls are mainly sexual violence. And there is, through our lens, the way the society or the policies or how people respond to whether the victim is male or female. So I just wanted to hear from you, your take on it. What are some of the challenges for gender in terms of reintegration, or just any thoughts on that could help? Thank you.
Yeah. So certainly we do have more survivors who are of sex trafficking who are female, but we know that men and boys can be victims of sex trafficking too, and both can be victims of labour trafficking. We are seeing more male survivors of online child sexual exploitation, particularly in Asia. And we're finding, just from our observations, that typically the males are wanting to engage less in the aftercare services than the females. Now that is a generalization, but they're more wanting to move on, and there's probably a bit more shame tied up with the exploitation. They don't want family to be involved or to be as aware of their exploitation. So that may also mean that they're less involved in testifying in court because they just want to move on. Certainly we do have males that are involved in the aftercare process, but that is generally what we see.
I think we have time for one more question. If we have one, you are more than welcome. Or if any of you has a question for each other, but not for me, please. I would welcome it. We have a few more minutes, and I don't want to waste any of our precious time. Thoughts, comments? Laura.
I have a very quick question. And I hope this doesn't turn the conversation in an odd way. I'm wondering whether or not prevalence studies actually have any impact on your day-to-day work in victim services on the ground.
That's a good question. Now what did I say? That's interesting. This is a little bit seat of pants, but the prevalence studies that I know of, they aren't only looking at numbers and percentage of population or percentage of a certain population. They include both our sex trafficking prevalence baseline and end line and our bonded labor. They include a wealth of information about the crime itself. Some of the, what do you say, Michelle, what do you call a study that has many different aspects to it? Multi-something, something? Mixed method. Anyway, studies will have focus group. They'll have the prevalence study, but they'll have a focus group. They'll have, interviews with top policymakers. They'll have interviews with survivors. So I do think that getting a sense of the breadth of the crime is important to just even planning engagement with the authorities to identify and bring to relief victims. But I also think the information about the crime is terribly important. For example, in the OSIC study that Nottingham Rights Lab did with IJM, that study includes survivor-led focus groups and talking to other survivors about how did this crime play out, and nobody knows better than than the now adults that they talk to about experience of victimization as children. So I think there's probably more of an answer, Laura, but it didn't sound too bad. I mean, coming from me. So thanks for asking. I think we'll let you all go so you can grab a cup of coffee before the last session. But one more, a bunch of cheers for the best panel of the conference.